Howdy everybody, welcome back to MSK. My name is Jonathan, and today we will be going over epicondylitis. So let's talk a little bit about this. So this is a pathology of the elbow, namely at the epicondyles of the humerus, both the medial and the lateral. And they're going to have slightly different presentations, and if you get a question on this, it will likely test your ability to distinguish medial and lateral epicondyle and the anatomy involved. And even though the name may be suggesting that it is the epicondyle of the humerus that's involved, it's actually going to be the muscles and tendons attached to the epicondyle that are inflamed or swollen or overused that lead to the presentation of these patients. All right, let's hop in and talk about our etiology, and we'll start with lateral epicondylitis. So think for a moment about the kind of muscles that attach to the lateral epicondyle. So if we take a look down here, we can see that our extensor muscles are going to be attached to the lateral epicondyle. Things like extensor carpi radialis brevis, extensor carpi ulnaris. We'll also have the supinator muscle that's out here on the lateral epicondyle of the humerus. And so an overuse of those muscles and repetitive wrist extension and supination is what's going to most likely contribute to a lateral epicondylitis. It can also be idiopathic and not associated with overuse, but that's less common in a board question. And so this is sometimes called tennis elbow because during a backhanded shot, when you extend and supinate the wrist in order to get the racket to move this way, you may have an injury of those extensor muscles. But of course, the injury is not limited to tennis players. Squash, racquetball, badminton, maybe even pickleball if you really bring the heat. These can all lead to overuse injuries of these extensor muscles and then lead to the injury we see here. In contrast, for medial epicondylitis, this is where we have more flexors of the wrist and pronators of the forearm inserted. Muscles like flexor carpi ulnaris, flexor carpi radialis, or our pronator teres are all attached here at the medial epicondyle. And so overuse of those muscles with wrist flexion and pronation are likely to contribute to medial epicondylitis. And so this pathology is sometimes called golfer's elbow because during that golf swing, the wrist will need to flex forward in order to resist the torque of the club. One way that helps me memorize which is which is that I think about in golf, you're trying to get it in the hole. So in for inside being the medial epicondylitis, whereas in tennis, you're trying to outmatch your opponent. And so out being for lateral epicondylitis. It also helps for the motion that we are going to flex in our wrist, which will lead to medial epicondylitis. And if we are extending out our wrist, that will be lateral epicondylitis. Additionally, this is most common in patients aged 40 to 60. And so if you're planning to be a physician that works near a country club, where you're going to have plenty of tennis players and golf players from 40 to 60, make sure you pay extra attention to this video. All right, we'll move on and talk about presentation. So lateral epicondylitis, obviously going to be lateral elbow pain that's worsened with palpation and the injuries that likely caused it, in this case, wrist extension or supination. And because there may be inflammation of the tendons and surrounding tissue, then there will be pain on that physical exam. And so medial epicondylitis will follow the same logic. There will be medial elbow pain also worsened with palpation and wrist flexion, because wrist flexion and pronation will likely contribute to the injury in the first place. And so make sure you understand the difference here, because whether wrist extension or wrist flexion contributes to the pain will be one of the easiest ways to distinguish these two pathologies. All right, let's move on and talk about diagnostics. So it's very often a clinical diagnosis. So if you have a patient that comes in and they're telling you they've been using their elbow and their elbow hurts, and it hurts with palpation and with wrist extension, then you are going to assume that there's lateral epicondylitis and that there is swelling of the affected tendons. But we may get imaging in order to rule out other pathologies. So a patient comes in and their elbow hurts, and you may suspect that there's a fracture of the elbow. But an x-ray will help determine that, because in epicondylitis, an x-ray will be normal and not show any fracture of the bones. Additionally, we may use an ultrasound to visualize tendon thickness, and because there's likely swelling of the affected tendon, an MRI will show increased tendon activity. And finally, let's talk about management of these patients. So the big first step will be pain management. And of course, for these patients, because it is often an overuse injury, we are going to advise that they rest and that they ice as needed and take NSAIDs appropriately. You may remember that we mentioned injection therapy as a pain management for rotator cuff tears. But we want to avoid corticosteroid injections in epicondylitis, as this can increase our risk for a tendon rupture. We may also add physical therapy or using a brace during movement or the sport involved in order to reduce pain and further injury. And finally, if a patient's symptoms are refractory to rest and physical therapy, we should consider surgical intervention. All right, let's do a recap and then we'll do a practice question together. So epicondylitis is an overuse injury of the tendons attached to the epicondyles of the humerus, with lateral epicondylitis being from wrist extension and supination, sometimes called tennis elbow, and medial epicondylitis being from flexion and pronation, sometimes called golfer's elbow. And remember, in tennis, we are going to outmatch our opponent, and so it will be lateral as we extend the wrist out. In golf, we are trying to get the ball in the hole as we flex our wrist in, and it is on the inside of our arm in anatomical position, the medial side. And again, this is most common in patients age 40 to 60. Lateral epicondylitis will be pain on the lateral elbow, worsened with palpation and wrist extension and supination, the motions that led to this injury. Medial epicondylitis will be pain with the medial elbow and palpation and wrist flexion or pronation. It is usually a clinical diagnostic, but we may use X-ray in order to rule out a dislocation or fracture, and ultrasound and MRI can help us visualize the tendon. We want to manage the patient's pain with NSAIDs, rest and ice, and avoid corticosteroid injections. And we may use physical therapy and bracing during activity, and of course, consider surgical intervention for refractory symptoms. And a practice question might sound something like this. A 57-year-old male comes into your clinic with complaints of right-sided elbow pain. He has recently retired and picked up tennis as a hobby, but has noticed that his elbow has been bothering him during his last few sessions. Vital signs are within normal limits. On physical exam, there is no notable swelling or deformities, but the lateral epicondyle of his humerus is tender to palpation. Additionally, his grip strength is equal bilaterally, but elicits pain on the affected side, as does wrist extension. Other than pain at the lateral elbow, there are no changes in sensation to the arm, and X-ray reveals no abnormalities. What action of the biceps brachii is most likely to elicit pain on this patient's affected side when resisted? So because this patient has picked up tennis recently and has lateral elbow pain with palpation and a normal X-ray, we are beginning to think of lateral epicondylitis. So recall that the biceps brachii has three actions: shoulder flexion, elbow flexion, and supination of the forearm. And so because this is lateral epicondylitis that supination likely contributed to, when the patient has resisted supination, this is likely to elicit pain. All right, that's everything from me. Thanks for watching. Good luck studying, and I'll see you next time.